Welcome. As you join, if you wouldn't mind putting down in the chat where you're calling in from today or tuning in from today. Welcome. We're just waiting a few minutes, letting everyone in from the waiting room. We're so happy you're all here with us today. We have a great presentation for you. One of our favorite doctors. So, San Francisco, Dallas, Los Angeles, New York, Denver. Oh, Denver. We just opened in Denver, our mobile clinic. I hope you can make it there. Atlanta. Yay. Dr. Cain, who's leading the presentation today, is in our Atlanta office. So great. Oh, yay. Janelle's here too. Awesome. Well, thank you guys all. Thank you everyone for joining us. My name's Amandalyn. I am on the marketing team at Kindbody. We host these Fertility 101s about every month. And we're so happy to have you here, help educate you and inform you about your options, a little bit about Kindbody. And we are so lucky today to have Dr. Cain, who is in our Atlanta clinic, which I was going to say is one of our new clinics, but since then we've opened up in Austin and Denver too. So we are busy over here, and we have one of our first Kindbody patients, Hope Elizabeth, Kindbody Atlanta patients, excuse me, Hope Elizabeth here with us today. She's going to share a little bit about her experience later in the presentation, but we're so excited everyone's here. As the presentation goes on, please send your questions to the chat. We have a few members of our client services and clinical team to answer all your questions. So send them. If there's any questions you don't want to share publicly, feel free to send directly to me, and I'll make sure that they are addressed. At the very end, we'll take a few of the questions and answer them together. Great. Dr. Cain, when you're ready, take it away.
Hi, everybody. Thanks for coming here. I'm Kristen Cain. I'm a reproductive medicine doctor, a fertility specialist at Kindbody, and I've been with Kindbody for about 5 months now. It's been going really fast, and we just opened our clinic in Atlanta, and things are going really well. So it's a pleasure and a privilege to talk to you today. I'm going to let Hope introduce herself as well, and then we'll go ahead and get started. Hope?
Yeah, it's nice to see everyone today. Thanks for being with us. I'm Hope Elizabeth Sonam. I live here in Atlanta, and I am one of Dr. Cain's patients. We just finished an egg freezing cycle that was pretty successful, so I'm honored that they asked me to be with you all today.
Thanks, Hope. And I'm so happy that you joined us today. You know, Hope has lots of good insights and interesting things to say about her experience at Kindbody. And at the end of the talk, we'll be able to hear a little bit more about, you know, what it was like to freeze her eggs. So, Amandalyn, we can do the next slide. So anyway, welcome to Kindbody. You can see our beautiful Atlanta clinic behind me. I wanted to say that Kindbody is a really interesting and unique company. Our mission is to make reproductive health care and fertility care more accessible for everybody, not just financially, but in terms of ease of making appointments, getting in to see people, and trying to take away some of the things that make fertility care so scary and difficult. Next. So, what we do is we do a lot of things. We do the full spectrum of fertility care, including fertility assessments for people who just want to know a little bit more about their bodies and get a sense of what their fertility looks like. We do egg freezing for people who want to preserve their fertility for whatever reason, not just medical reasons, but maybe, you know, you haven't found the right partner yet, or you want to have children at a little bit later time. And embryo freezing, which is fertilized eggs that get frozen. We do inseminations in vitro. I'll talk a little bit about the difference between those two, but inseminations is a simple treatment. We do donor egg and donor sperm, and then we do GYN services as well. Not only can people come into Kind Body if they don't have a gynecologist or an obstetrician that they work with, they can come here and get their PAPs updated or get their birth control refilled. We do urgent care GYN visits as well, which is something completely different and completely new. It's possible to walk into a Kind Body and say, look, can you see me? I need help with this, a UTI or something like that. Can I get some help with this? And even those things are now becoming available. And we also try to be more holistic in terms of we offer full support and a full spectrum of LGBTQ services. We offer wellness and nutrition. Remote acupuncture is a thing at Kind Body, and therapy appointments. So we are really trying to take care of the whole person, no matter where you are in your fertility journey. Next, please. It's really important to know what is going on with your body. We think one of the most important things is that you have the knowledge to make good decisions for your life. One of the most important factors of your reproductive health and your fertility is time. We're all getting older. And as we get older, our eggs become fewer in number and lower in quality. And so there is a time constraint for women and men too, with regard to their reproductive potential. So we think it's really important that you're able to access fertility care when it's right for you and not to make people wait. Next, please. This matters because we don't really know. We don't really do a good job about teaching people how to improve their fertility or how to protect their fertility. We do a good job sometimes about helping people not get pregnant, teaching them how to avoid pregnancy, use birth control properly, avoid STDs. And then with single people or same-sex couples, sometimes it's necessary to do even different or more intense treatments just to get to the point of having a baby. It doesn't happen by accident in those groups. So it's really important for us to know what's going on with this. Next, please. So let's start at the beginning. Women are born with all the eggs they're ever going to have. So usually about 1 million, maybe 2 million eggs at birth. And by the time we hit puberty, we're down to about 400,000 eggs. And at that point on, we lose about 1,000 eggs per month. It doesn't seem fair that we're losing them at such a huge rate. But right now, your fertility is the best it's ever going to be from this point forward. Next, please. And the important thing to realize too is that being healthy and having good health habits is great, and it will help your fertility where you are now, but it doesn't make your eggs younger. One of the things that we have to be concerned about is, fertility declines as a process over time. It's not like a switch flips at 35 and suddenly you're not as fertile as you were, or at 40, because even under the age of 35, 1 out of 10 women experience premature low ovarian reserve. Sorry, I'm tripping over my words a little bit. I'm a little nervous, I gotta say, because normally when I give talks, it's to medical students who are like, don't really care if you're a bit boring. And it's not the same thing with a savvy group of people on the internet. Next, please.
No one thinks you're boring. We're all interested to hear this.
So the only way to really know if you're in that group of 1 in 10 is to get tested. And that's one of the things that we make a point of offering at Kind Body. It's also important not just to have enough eggs, which we can test to get a sense for how many eggs you have, but egg quality matters too. And that's harder to test. That's kind of a proof is in the pudding thing. If you have a baby, that was a good egg. If you do in vitro and we look at the eggs under the microscope, we can see which ones look good and which ones aren't, but we still can't really tell among the ones that look good which one's going to make the baby. And that goes through the whole process of IVF. At every step of the way, we kind of see better and better which ones have a chance of being a baby. But we don't have a nice blood test or ultrasound, anything easy that we can do to check your eggs. Next, please. But you're never too young or too old to learn more about your fertility. You can be proactive, and we're all about that. We're all about taking the reins of your fertility and learning about your body, getting your facts, finding out where you stand, and then getting good information about what your options are. Next, please. So when are you most fertile? Well, if your cycle's regular, you normally will have your best fertility between day 10 and 14 of your cycle, if that's a 28-day cycle. Now, some people have regular cycles that are 32 days. Some have regular cycles that are 25 or 26 days, so those days will change a little bit. But the bottom line is you have about 4 fertile days per month. So if you look at this calendar, that the red dot one is the first day of your cycle, the day your period starts, and ovulation is on the yellow dot day, but for about 4 days or so before ovulation, you also have decent fertility. So that's 72 hours every month, if you're regular, that you have a chance to become pregnant. And that can be a little difficult to pin down. We're here to help you with that too. Next, please. Although I said earlier, being really healthy doesn't really make your body younger, doesn't make your eggs younger, it still matters to have as good health as you can before you're trying to get pregnant, while you're trying to get pregnant, and then while you are pregnant. Your lifestyle and diet matter. Minimizing your alcohol intake when you're trying to get pregnant to 4 drinks or less per week. A healthy diet, lots of plants, lots of water, not a lot of meat is good for you. Smoking is one of the worst things you can do for your fertility. Smoking makes your eggs 10 years older. But the good news is that some of the damage that can be done to your ovaries with smoking is reversible. And if you stop smoking now, you can reverse some of that damage. Family history matters. If you have people in your family who are able to have children in their 40s, that's reassuring, but it doesn't necessarily mean that you're safe. We still need to know about you because you are different from the people in your family. But if there's a family history of going through menopause at a young age, that's something that would be important to know. Or if there are any genetic diseases in your family. And your mental health is important too. We want to make sure that when you're going through any fertility process, even just finding out about it, up to all the way through in vitro or having a baby or postpartum, that your mental health is cared for, because that's such an important part of your life. Next, please. So what does it mean to be infertile? The definition of infertile, the old-fashioned definition, is a couple under the age of 40 who have been trying to get pregnant for 1 year and have not succeeded. So not using birth control for 1 year. However, if you're over 39, we recommend an evaluation if you've been trying for 6 months. However, 1 in 8 couples experience infertility, and it doesn't seem fair to use these old-fashioned definitions to wait and make people try when there may be something else going on, something easy to check. So at Kind Body, we believe that if you want to check, even if you've only been trying for a month, 2 months, haven't started trying yet, it's reasonable to come in. I saw a patient recently who's planning her wedding, and she's got a fun year of weddings planned, and she She said, you know, it's okay. I could get pregnant right now. I'd rather not. I'd rather wait a year and have fun this year, but I want to make sure I'm okay. That's totally reasonable. Come in and get checked out. It's also important to know that infertility is not just a woman problem. Half of all fertility problems involve the man. In fact, 1/3 of all infertility cases are just male factor infertility. And about a third to a fifth are male and female combined. So it's really important to understand that. Next, please. There's no magic formula for patients. We individualize our patient care here. We want to know all about you, your body, your needs. Everybody's different. People age at different rates. People have different needs. Some people want a big family. Some people want to start later. Some people only want one baby. Some people aren't even sure if they want a baby, but they want to know if they can have one. The only way to know where you are is to come in and get a checkup. Next. So that would be a fertility assessment. So fertility assessment is an appointment with a fertility specialist like me. This can be done virtually or in clinic. And what we do is we talk. I take your history. We find out what's going on with you, what your needs are, what your plans are, and then we set you up for testing, which can be done after your virtual visit or at the time of your in-person visit. And that test includes a blood test for AMH hormone, which is kind of like a gas gauge. So normal AMH hormone is between 1 and 6. If it's less than 1, then we worry that you might be starting to run low on eggs and might not get as many eggs if you do something like IVF or egg freezing. And maybe you might want to work on preserving your fertility a little bit sooner. Another thing we do is an ultrasound to check an egg count, which we call antral follicle count. So follicles are the fluid-filled sacs that contain eggs, and every month you ripen up a group of follicles that we can see on ultrasound. Remember when I said 1,000 eggs are lost a month? Most of those are so tiny we can't even see them. But I have a little prop here. Let's say this is your ovary. You've got a bunch of eggs in here. Most of them we can't see, and every month a few of them are made available. So I've got these like mints. A few of them are made available for us to use, and of those maybe one will ovulate and the rest just go by the wayside. They just go away. So we can't tell by looking at the ovary how many eggs are still in there. We can only see what's been kind of released and available for us to measure on ultrasound. Next, please. The path to parenthood isn't always straight, but we want to support you no matter how we can. You know, we can support you in any way, whether it's mentally, emotionally, we're here for you. Next, please. I'd like to say that you have options. So when you get information about your fertility, even if it's not what you wanted to hear, we want to talk about what your options are. And a lot of times people get good news. Most of the time they do. And that's good too. You know, then we just recommend rechecking your fertility in a year to make sure that you're staying good, and just treat this as part of your routine well woman care. But options include egg freezing. If the eggs are not fertilized, you don't want to commit to a sperm provider yet, a partner or a donor sperm. Embryo freezing is if you are in a committed relationship, you want to get fertilized embryos for use later on. Maybe you want to try to have a baby now, but you want a bigger family, and you want to save those embryos for later to make sure you're still able to have a second or third or fourth child. That can be a good way to go. And other fertility treatments like insemination, where we find out what day you're ovulating, maybe give you fertility meds, and then place sperm up inside your uterus on your day of ovulation with a little plastic tube. or in vitro, where the eggs are actually removed from the body and fertilized in the lab, and then a fertilized egg is placed back in the uterus. And then there's third-party reproduction, which I'll be talking about later. Next, please. So let's start with egg freezing. What is egg freezing? Egg freezing, we call it pressing pause. Egg freezing is extracting just eggs from your ovaries. We give you fertility meds to ripen up the eggs so that we can retrieve them. So we, remember I said you have those follicles that we can see in ultrasound? Those are the ones that will respond to the fertility meds and ripen up. And we can actually harvest those eggs and freeze them for down the road. And eggs can be frozen for years and years and years. Next, please. Is egg freezing right for you? Well, you have to ask yourself some questions. So first of all, how old are you? How many kids are in your ideal family? If you're really young, maybe it's not time to freeze eggs yet, but if you're, in your mid-30s, maybe that's a good time to freeze some eggs, especially if you want to have more than one child going from this point going forward. How many children are in your ideal family? And how old do you want to be when you have your first child? If you're in your late 20s, you've got good ovarian reserve, you want to start trying to have a baby now, then start trying. But if you have diminished ovarian reserve, or you want to wait until you're 35 to have your first child, freezing eggs makes good sense for you. And not only that, this one's really important. How old will you be when you have your last child? This is the final answer. As you have a baby, that takes a year, right? Almost a year of trying to get pregnant, getting pregnant, and having the baby. And then you got another year where you've got the baby, and now you're taking care of your baby. Maybe you're breastfeeding, maybe you're recovering from the birth, but that's a busy year. It's not like you have a baby and go out and get pregnant the next night and have another baby. That it doesn't, your body doesn't really work that way. So, and your life doesn't either. So you need to know how old you want to be when you have your last child, because you kind of want to assume 2 years per baby. Next, please. So how does it work? Well, we talked about recruiting the eggs. And next. And what we do is we're a little opportunistic. So you got these eggs sitting out, they're not doing anything, you're not going to use them, but we take hormones that contain FSH, which is a brain hormone that goes to your ovaries to stimulate the ovaries to ripen up eggs. And we give you a higher dose of that than you normally would make every month. And that gives all those other follicles a chance to ripen up. And it helps you fully mature a batch of eggs. Maybe a dozen eggs, maybe more, who knows? Next. So how do they work? Well, we stimulate the ovaries so you can get more eggs at the retrieval. And you take these medications, they're injectable medications, and we teach you how to do it. And you inject these medications for about 10 to 12 days. And during that time, you're busy. You come in for 4 to 6 visits in our office. We check an ultrasound to see how the eggs are growing and how many you have and when they're going to be ready. We also check blood work to see if we need to change the dose of your medication. Next. It's about a 2-week timeline from start to finish. So it really doesn't take a very long time, but like I said, you are busy during that time. And then once the eggs look like they're perfectly ripe, at the end of that time, we do a final injectable medication called your trigger. A trigger is 1 or 2 medications, depending on you and what we think is right for your body. And you take those times. So they're given 35 hours before we want to retrieve the eggs. It's important to do that exactly at the right time, because we don't want you to actually ovulate, because then the eggs are poof, gone. But we need them to be loosened up from the ovary enough so that we can actually retrieve them. Because if we go too close to the trigger shot, or you didn't take a trigger shot, then the eggs won't come out. Next. So how does the retrieval work? Well, you come to our office. Our Kind Body offices all have a retrieval operating room. It's very small and nice. and you go to sleep. You're asleep for about 10-15 minutes, and we do a vaginal ultrasound that helps us place a needle into the ovary, and we can see the needle go into the ovary, and then we can see the fluid come out of each of those little follicles into a test tube. And then the lab gets that fluid and they can find the eggs. Next. The difference between egg freezing and embryo freezing is really minimal. The first part that I just described is the same for both. Embryo freezing is in vitro. So in vitro is where the eggs actually get fertilized by placing a sperm into each egg. And then the fertilized eggs are grown in our lab for a few days. And then the embryos can be frozen. Next. Your eggs can be stored as long as you like. We have been able to store eggs and embryos for years. And in fact, there are a couple of babies out there who are sisters who were born from 23 and 25-year-old embryos that were stored for that long. And the funny thing was their mom who had them was 23 when she had the first baby and 25 when she had the second baby. From these stored embryos. So these little girls are fine, healthy, everybody's happy, but they can be frozen for a really long time. And keep in mind, that was with 2 decades old technology. So our technology now is even better. So they can be stored as long as you want, as long as you need them. We hope you'll get pregnant on your own, but if you need those eggs, you've got them. And then we can do in vitro where we take them out, fertilize them, and grow the embryos out. Next. So IVF, I already talked about this a little bit, but one of the parts of IVF that I didn't talk about is the embryo transfer. So the embryos, once they're created, it's possible to get more information. It's possible if we wanted to do genetic or chromosome testing of the embryos, and then freeze the embryo before we freeze the embryo. And then embryo transfer is done, it can be done fresh right after the eggs are frozen, or right after the eggs are fertilized, I'm sorry. But usually the embryos are frozen, and then at a later date, it can be the next month or it can be months down the road, your body is prepared to receive an embryo with hormones. And we make sure your uterus is healthy and your body is healthy. And then the embryo is placed inside your uterus again with a thin little plastic tube. Next. So another thing that I promised to talk to you about a little bit is third-party reproduction. So third-party reproduction is donor sperm, donor egg, gestational carrier, what we sometimes call surrogate. These are things that we need for third-party reproduction, or for people who, for whatever other reason, don't have access to eggs or sperm, or a uterus, or a healthy uterus, or have medical reasons that they can't carry a baby. At Kindbody, we call that family building. Next. So as you can see, you have lots of options to getting pregnant, from just getting good information and trying on your own, getting pregnant naturally with maybe some good advice about how to maximize your health during this time, to simple things like insemination, where sperm is placed up inside your uterus, and donor insemination is done the same way, or in vitro, third-party family building, fertility medication with timed intercourse at home, lots of options. Next. So what do we do next? Well, the next step is, if you're interested in learning about this, there's no harm in learning about your own health and where things are. So we recommend a fertility assessment if you have not been trying and want to learn more. If you want to just do a well woman visit, but learn a little bit about Kindbody by doing that, we can do that. If you have been trying to get pregnant and have not conceived yet, then we would call that a conception assessment appointment. And that also includes an ultrasound and AMH blood test. But no matter where you are, we can help you figure this out. And likewise, if you are in a partnered relationship with a male partner, we can schedule you for a semen analysis as well, which is an important part of an early fertility evaluation. Next. And now I'd like to turn this over to Hope Elizabeth, and we're going to chat a little bit, she and I. And I love Hope's quote here. So when did this pop into your mind, this quote?
Yeah, thank you. And thank you for all of that. I'm Hope.
Hope, Elizabeth, will you get a little bit closer to your mic so we can hear you better?
Yeah, is this better?
Yeah, thank you. Sorry.
No worries. Thanks, Amandalyn. I'm a patient of Dr. Cain's here in Atlanta, and I just had my egg retrieval from the egg freezing process last month on June the 17th. And I was a little bold. I actually shared the entire process on Instagram because after I had my initial consultation with you, Dr. Cain, I left there feeling like, why didn't I have this information before? I'm a 33-year-old single, cisgendered, heterosexual woman, and I went to a women's college and, have taken all of the health classes. And why aren't we talking to women about their fertility? So I kind of took one for the team and started sharing on Instagram. This was just kind of the ultimate theme of the journey. I connected with so many people. The egg freezing and the IVF community is really powerful and really supportive. I was connecting with people that used to babysit me, or people in my brother's classes, all different things like that all had different fertility, infertility struggles and issues, kind of cheering me on through this journey. So that was kind of my ultimate takeaway. I can go into anything you want to know, Dr. Cain, about why I chose to do it, or what was easy or what was hard.
Yeah, tell me, so where are you in your fertility journey right now?
Yeah, so I have always known that I wanted to be a mom, and I say that proudly. I've always just had that instinct. And did I think that I might have already been started on that journey by now? Sure. But, we make plans, God laughs. So right now, evaluating where I am in life, I noticed that actually when I was dating with this interesting sense of urgency that I'm sure people could smell. So this was something that, in knowing the science and in educating myself, was something that I felt like I could give this gift to my future self, and potentially my future self and my future partner, that, maybe within the next couple of years, I do get to have a kid naturally and on my own terms. But by the time I have that second or third, I might need a little help. And so to know that I have 33-year-old eggs frozen in time for if and when that day comes just seemed like a really great investment for me in my future.
I think that's so great. And what you said about dating right now, it reminded me of when I was in my early 30s, and I wish I had the opportunity at that time to freeze some eggs. I think it would have gotten rid of some of the whiff of desperation that I carried around with me.
It really is a mindset shift. And I've, again, with so many people through sharing my story, and I have it saved in a couple of highlights on Instagram. If anybody is interested in watching me give my shots, you're welcome to. But yes, I've connected with so many women about that, and it changes your mindset. It just kind of lets you take a deep breath, and I could use those eggs with donor sperm one day if a partner isn't in the cards for me. So it just the empowerment, I think, is the biggest takeaway for me in my position.
It really is empowering. It really is empowering. And I appreciate you sharing why you froze your eggs. What was the most pleasant surprise about the process of freezing your eggs and going through this?
So when I sat down with you for the first time and then kind of got into the Kind Body portal with everything that was kind of predicted for me doing an egg freezing cycle, a pleasant surprise to me was that we knocked it out of the park. And I know that's not true for everyone, but just my expectations were exceeded in terms of what we were able to do from this cycle. And then also just it was a great process. It was unlike any other healthcare or medical experience that I've ever had. Very concierge, very intimate. I mean, I was in there every other day with your team, and I miss them. Like, I wonder what Laura's doing and what Shimana's doing. And so
that's in vitro. We get to know people pretty well because it's a lot of visits in a short period of time.
it really is. So yeah, it was very supported, very nurturing, for sure.
Well, thank you for that. And what was maybe a not so pleasant surprise about this that you wish you'd maybe been warned about earlier?
Well, I knew what I was getting myself into in terms of obviously budget, finances. I mean, that's, as I was sharing my story, that's everybody's number one concern is, how much did it cost? And are you going to have to do it again? And all of that stuff. And I budgeted for the Kind Body piece of it. I budgeted for the medicine piece of it. And then of course there's the lab work piece of it. And so for me, I'm fortunate in that I have a great job and I'm able to take care of these things on my own. But I just think about people. I think about humanity and I think about our declining birth rate. And I wish that services like what Kind Body offers are more accessible to more people because we deserve options. And I feel like society has evolved in a way to where, we can do things later in life, but unfortunately our bodies haven't. So it would be nice for more people to be able to take advantage of this earlier.
100% agree. 100% agree. And is there anything that you'd want to be sure your friends know about freezing eggs? Like, what would you want to tell them, or make sure people know about embarking on this journey?
The number one thing is to get tested. If you have any desire to have kids naturally in your future, even if you're on the fence about it, just to go and get your numbers and know what you're working with. And so you can make a thoughtful plan for yourself with the guidance of someone like a Dr. Cain. It gives you so much peace of mind. And I have heard really sad stories from people that I know who unfortunately, found out at 32, which was me last year, that they were going to be on the donor route track because, they were that one and whatever that couldn't, that levels went down earlier. So the earlier, and I don't know what you would say would be the prime age to do that, whether it's your late 20s or 30 or whatever. I was fortunate at 33, but just to know what you're working with because it's your body. And
right.
Why would you want to know?
Exactly. And, like I said before, it's wherever you are, this is as good as it's going to get. Yeah. So it's hard to say.
I think about if I would have done this at 28, what my last 5 years of dating would have been like. I'm sure it would have been totally different. It really would have been. So neither here nor there.
Is there anything else that you'd like to say or share with us before we turn it over to Amanda Lynn? She's going to talk about some cost issues as well.
No, I'm just really grateful. Thanks for having me, Amanda Lynn, and thank you, Dr. Cain, for literally everything. I really appreciate it.
So I'm going to turn this over to Amanda Lynn, and she's going to share with all of you, the money stuff, and then maybe take some questions.
Exactly. Yeah. Thank you. Thank you both. Hope, thank you so much for sharing your story. And Dr. Cain, we have a lot of questions coming in, but you've addressed most of them already. So it means we did a good job tonight. We do take insurance. So not every insurance plan covers fertility, but most will cover the assessment. So come check us out, email with any questions, navigator@kindbody.com. We also do offer a employer benefit. So if this is something that you think your company should offer, you're interested in learning more what that looks like, email us too. We can share information with you, have conversations with our, our enterprise team, see if that is an option for you and your employer. And thank everyone tonight for joining us. So we do have a discount for you guys. So if your insurance does not cover your assessment, use the code July101, get 50% off of the assessment. If you're going to move forward with the cycle, egg freezing, IVF, IUI, we have some discounts here. So use the code July101. If you're in Atlanta, try to get in with Dr. Cain. You're very lucky, but there are amazing physicians and providers at all of our clinics. We are in New York. We have 2 clinics in New York City, 1 in Princeton, New Jersey, Atlanta, Austin, 2 in the Bay Area, 2 in the LA area. And we just opened up our mobile clinic in Denver, and we'll have a physical location just in the next few months with lots more clinic openings happening. So if we're not where you are now, we will be very soon. So stay tuned. Again, the code's July101. And now let's get to some questions. I have to just stop sharing my screen. Okay, perfect. I will start with the one that just most recently came in. Is it worth freezing your eggs at 39 or more meant for people who are under 35?
It's absolutely worth it, because if you're 39, but you're still not in a place in your life to have a baby, especially if you want more than one baby, then it's really important to try to freeze your eggs now. You don't want to be doing this at 42. You still can get good eggs. You may need to do more than one cycle to get as many eggs as you want, but we can help you figure that out. In general, under the age of 35, it takes about 10 eggs to make one baby. That number may go up as you get into your late 30s, but I can share some information with you, or any of us at Kindbody can, about how to put that into perspective and to help you figure out how many eggs you would want to have frozen to accomplish the family that you want to have.
Great, thank you. How likely are people with a low egg reserve to have a healthy embryo through one cycle of IVF? Or is that of something where they need to prepare themselves for possibly multiple cycles?
So low ovarian reserve doesn't necessarily correlate with egg quality, especially in younger women. So younger women who have a low ovarian reserve, basically what we're talking about is we might not get as many eggs, but we'll get what we can, and you may want to wrap your head around needing to do this process more than once. However, as women get older, both the ovarian reserve and the egg quality tend to decline. So we try to give you as accurate information as we're able to with that. And there are all kinds of models, mathematical models that we can show you that give us an idea, if you have this many eggs and you're this old, what are your odds of having a baby with, those eggs, to help you decide how many eggs you want to freeze and get there. But even with low ovarian reserve, it's still worth trying to get pregnant. It doesn't mean you can't. And it doesn't mean you need in vitro. Not everybody does. Sometimes, you have low ovarian reserve, but you just want one baby or one more baby. Well, there's no reason you can't try with simpler things, but what you don't want to do is wait.
Exactly. Great. We have a couple questions about IUD and birth control. So how soon before you're going to move forward with an egg freezing cycle, do you need to have your IUD removed and get off birth control? And then another follow-up is, do you have to be off your birth control and IUD to come in for an assessment?
So you don't have to be off your birth control to come in for an assessment. We will take you as you come. So just come as you are, continue your birth control. You're on it for a reason. Just stay on it. You're not, because the reason is you're maybe not ready to have a baby yet, or you're using it for some other reason. For egg freezing, what we'll do is we'll usually say, okay, we want you to stop your birth control on thus and so day, and then come in to start your meds on this other day. and we'll plan out your cycle that way. With an IUD, you can leave the IUD in place, and we no longer make people remove their IUD to do an egg freezing cycle.
Correct. Yeah. We have a few questions about like fibroids, endometriosis, PCOS. Is that something that you work with patients on and can address with patients when they come in?
Yes, absolutely. Those are all important things that can affect your fertility. So we do address those things, and we, talk to you about what is going on, what we think needs to be done with these things. Do you need surgery or not? Do you need medical treatment? Is this something that you would try to, work around first to get your eggs or to have a baby and then maybe deal with at a later date? And we go through all those options. So yes, we take care of patients with all of those problems.
Great. Does your egg retrieval, I'm going to only do a couple more questions. Does your egg retrieval, oh, now it's scrolled past. Does your egg retrieval timing need to line up with your ovulation schedule? I know you kind of went into this, but maybe just. No. We
can control the cycle. And we usually do. We usually will, after we've evaluated you and decided what kind of medication protocol we want to use, a lot of times we'll give you something to line you up and so that you know when your egg retrieval should fall. And so you have a little bit of control with this too. Every once in a while, I'll get a group of teachers that come in and say, can I do my egg retrieval on President's Week because I'm off, or something like that. And it's possible to work around that so that you can, you just can set it up. So we can use birth control pills or other medications to kind of line you up for when we want to start your medications. And for egg freezing, if you have an IUD in place, we can just start whatever day we want.
Great. Thank you. We have a bunch of questions in here about what insurance we take. I did go over them on that slide. If you still have questions, please email us at navigator@kindbody.com. Also, if you have like very specific questions about previous results you've gotten, you can still come in and schedule an assessment. We'll redo all those tests, and our providers will go through the results with you, looking at your past results and the new ones. And someone asked a question about the Denver mobile clinic. Could you move to another clinic? The nice thing about working with KindBody is you could come to any of our clinics. So if you started the process in Austin and you moved to Atlanta, or you just really want to work with Dr. Cain, you could go to Atlanta and have your go through the process there. We had lots of people during COVID who were in the middle of a cycle in one place and went somewhere else and were able to easily finish their cycle somewhere else. So it's the beauty of working with KindBody and us being all over the US.
Right. We've had a patient who's been traveling between LA and Atlanta, and just depending on where her life has her. Sometimes she does stuff here, sometimes she does stuff there. It's pretty seamless. She's gotten to know people in both clinics, and we all know her, and it works out fine.
Yeah. Yeah. And last hope, I just want to say there is like this kind of myth in the fertility world that people believe that once you freeze your eggs, you'll find your partner. So I know lots of people, and I'm sure a lot of people who, I know a lot of people at KindBody know many people who, once they froze their eggs, it's kind of like a weight was lifted off their shoulders and they went back to having fun while dating and not asking, well, how do you want to raise your children one day? And so we're sending you a lot of good vibes. If I did not get,
I think you might be right. So yeah. It's a good thing.
Yeah. A lot of people we spoke with are like, yeah, I froze my eggs and I went on a date 3 weeks later and boom, done. So sending you some good vibes. Awesome. If we did not get to your question, I'm so sorry. Feel free to email us, navigator@kindbody.com. If you're in Atlanta, book an appointment with Dr. Cain. Please use a code July101 to book your assessment. The code you need to book the assessment in the next 4 weeks for the code to be good, but you can always come to another future event and we might have a code there too. So please, we hope to see you in one of our clinics soon. Appreciate everyone for joining us. Dr. Cain, Hope Elizabeth, thank you so much.
Thank you.
And everyone have a great evening.
Bye.
Bye, guys.
Bye.